And as far as our management concerns, we don't give any medications to the Leber's patients. All we can do is to support their lifestyle, such as like stop smoking and maybe stop drinking too heavily. But we actually provide the patient with low vision aids. As we have a low vision clinic in Kyoto University Hospital, so we refer those Leber's patients to get some low vision aids. And in collaboration with Japan Federation of the Visually Impaired, we support their life with the social care system. And also we support their social independence in terms of working health. So these are the current management as far as lone patients concerned. Basically, our management consists of lifestyle support services. So after we make a diagnosis of lone Leber's hereditary optic neuropathy, we send back to the referring ophthalmologist and ask them to take care of their daily ophthalmological management. That is our current practice. The major barriers to diagnose and treat Leber's hereditary optic neuropathy, as far as we are concerned, the genetic analysis must be carried out by ourselves and not covered by the Japanese health insurance system. So that the cost of genetic analysis is very expensive, but we have to pay all the expenses by ourselves. So there are some outsourcing is available. However, based on the regulation of the Japanese health insurance system, we are not do such an free services. We are not able to ask each individual patient to pay their expenses for blood test, as long as we are using Japanese health insurance system. And so if we are independent, run our office, not supported by the Japanese health insurance system, we'll be able to ask the patient to pay their expenses for their blood test. And usually the patients have to pay almost say 100,000 yen for one blood test. Therefore, as we are doing that, using the Japanese health insurance system, so we have to do it by ourselves. So all the costs we have to provide ourselves. And therefore, as I mentioned, we only do the blood test of mutation tests on three main point mutations. And the cost of full genome sequencing of mitochondrial DNA is more expensive, so that we have not yet done, even with the patients clinically suspected of lone and negative for the main 3-point mutations. But we have not yet done. So clinically presumable loans, there are some patients we are taking care of. And as I mentioned previously, as far as we are concerned, in Japan, there is no institute where gene therapy is provided. And idebenone is certainly was first reported by the Japanese ophthalmologist, but idebenone was not allowed to prescribe the Japanese patients because of that drug is not allowed to use. So therefore, we don't give any medications. But we have some expectations for gene therapy, of course. Based on the ongoing clinical trials of 3 groups, such as in Europe and US and China, lone is a good candidate for clinical trials. it involves a specific cell type and permits the administration of treatment during the window of time between the onset of vision loss in the first and second eyes. ND4 mutation is most common and has the worst prognosis. And it seems gene therapy needs only one-time intravitreal injection, and its effect lasts for 2 years or more. So it's amazing therapy as far as this intravitreal injection concerns. Only one injection can last for as long as 2 years. That is amazing. And actually, based on the previous clinical trials, a visual improvement of 0.3 logMAR vision is amazing. But there are some patients with insufficient visual improvement, and various responses are actually seen. So we still don't not yet what is really affecting, is effective in terms of treatment. It's still not unknown, I think.